Welcome to Madison Noteworthy Health. I'm your host, Dr. Frank Byrne, and I'm delighted to be here today with James Diaz, the CEO and founder of Wellbe. Thanks for joining us, James.
Yeah, I'm glad to be here, Frank.
Tell us a little bit about Wellbe. What is it and where are you going?
Wellbe is an attempt to bring the patient in as a partner to their health issues and their health challenges. We think in the 21st century, patients want to be involved in their decisions and want to know more about their treatments and their programs. And by making them better partners in their healthcare, we think that we can actually transform the way healthcare works.
Absolutely. As a practicing physician, I was always looking for ways to engage patients as a partner in their health. So fabulous work. How'd you come up with the name?
Well, the name has to do largely with the well-being of the individual, the health and well-being of the individual, but it's also a play on an old TV hero in healthcare called Marcus Wellbe that a lot of people will recall was one of the first TV dramas that was out there. So it's a double entendre.
James, talk to us a little bit about your product and how you connect patients and caregivers.
Yeah, sure. I think the best way to envision what we do is to think about a patient, a loved one that a family member that has gone in for a major surgery. What our product does is essentially act like a GPS through the journey of their care. It essentially gives you step-by-step instructions on your smartphone or tablet or your computer, or any device of your choice, what you need to know, what you need to do, and how to work with your care team to have a safe and effective outcome. So a surgical procedure has a time of preparation, an actual inpatient experience, and then a recovery period. Some of those things can be 3-4 months long. And so every step of the way, sometimes 40, 50, 60 different actions are required to be taken by the patients and their family. Well, that tool tells you exactly what you need to do at the time you need to do it. On the other side of the fence, we have coordinators and navigators who can manage very large populations of patients as they move through their plans of care and track whether they're on, monitor whether they're on track or not, and then decide what they need to do with it. So like any other industry, 30% of the patients who are perfectly fine with being self-directed and will work through their plans. Other patients who might have complications or are complicated patients can then be using up those resources like the navigators and stuff. So we make the care much more efficient as well. So in a nutshell, we're sort of like a GPS for the patient and OnStar with the health system. We're kind of like, if something goes wrong while I'm working through my plan of care, it automatically connects you to the resources you need, and that person can help you.
So what you're doing is you're taking the labor it requires to intensely manage patients for the best outcomes.
Yep.
And distributing that so that the resources are going to where the greatest need is.
Exactly right. Exactly right. You
in
can
both directions.
Completely optimize the resources and the attention. Yeah, exactly.
If you're paying attention out there, I would say this. Some of you who are thinking of going into healthcare, remember what James said, there's never been a better time. And thanks for joining us on Madison Noteworthy Health. See you next time.